So, the first on our tour is the upper respiratory tract that consists of structures located outside the thoracic cavity. Though I mentioned it already, but I won't bother repeating it, that the upper respiratory tract includes the nose, pharynx, and larynx. Now, starting off, air enters and leaves the respiratory system through the nose. A vertical plate of bone and cartilage, called the septum, separates the nasal cavity into two halves, the nostrils. Just inside the nostrils are small hairs called cilia. Coated with the mucus, their job is to filter out dust and large foreign particles. The nasal cavity lies just over the mouth, separated from the oral cavity by a bony structure called the palate, which is also known as the roof of the mouth, where the hard palate is the front part of the roof of the mouth, continuous with the soft palate, which is the back part. Now, the nasal cavity is lined with epithelium rich in goblet cells. And you know the function of goblet cells is to produce mucus. Now, projecting from the lateral wall of each cavity are three bones called conchae or turbinates. These bones create narrow passages, ensuring that most air contacts the mucous membrane on the way through. As it does, the air picks up moisture and heat from the mucosa. At the same time, dust sticks to the mucus, which is then swallowed. Now, the branches of the olfactory nerve, that are probably the nerves responsible for the sense of smell, penetrate the upper nasal cavity here and lead to the brain. Also, the nasal cavity has some air-filled cavities present around it. These cavities are known as paranasal sinuses. To visualize all four of them, let's have a look at the anterior view of a human face. Now, these four pairs of paranasal sinuses are named for the bones in which they reside, are the sphenoid sinuses, as shown here, the frontal sinuses, this one, the maxillary sinuses here, and the ethmoidal sinuses. Now, what they all do is to humidify the inhaled air. They also lighten the skull and act as resonators for sound production. So, after passing through the nasal cavity, the clean air enters the next part of the upper respiratory tract, a muscular tube, present just behind the nasal and oral cavities, the pharynx, that you call throat. Now, the nasopharynx, the oropharynx, and the laryngopharynx are the three regions that make up the pharynx. Now, you can better guess from the name that nasopharynx connects the nasal cavity to the throat. It extends from the posterior nares to the soft palate and contains openings for the right and left eustachian tubes. Oropharynx, connecting the oral cavity, of course, to the throat. It is a space between the soft palate and the base of the tongue. And what it contains are the palatine tonsils and the lingual tonsils found at the base of the tongue. And the third part of the pharynx is laryngopharynx. That passes dorsal to the larynx and connects to the esophagus. Now notice here that it's only the air that makes its way through the nasopharynx, while both food and air pass through the oropharynx and laryngopharynx. Now, after the pharynx, air enters the last part of the upper respiratory tract. That is larynx. Well, it actually has three functions. First one is obvious from the other name of larynx, that is voice box, because it contains the vocal cords, so it is responsible for producing sound. Secondly, it prevents food and liquids from entering the trachea. And third, of course, is that it acts as an air passageway between the pharynx and trachea. The larynx is formed by 9 pieces of cartilage that keep it from collapsing, a group of ligaments that bind the pieces of cartilage with each other and to adjacent structures in the neck. Now, the largest piece of cartilage among these is the thyroid cartilage, which is also known as the Adam's apple. Well, the ring-like cricoid cartilage is the one that links the larynx to the trachea. Now, when you are eating food, it is likely to enter your airways. Now, what prevents this form happening is a flap of cartilage, the uppermost cartilage though, called the epiglottis, which closes over the top of the larynx during swallowing to direct food and liquids into the esophagus, hence blocking its way to the air passage. For instance, if anything enters the airways other than air, it initiates a cough reflex to throw it out like this. Now, to observe some other structures in the larynx carefully, let's have a look at the anterior and superior view. Here, you can see the epiglottis, thyroid cartilage, and cricoid cartilage again. Now, the mucous membrane that lines the larynx forms two pairs of folds. The superior pair, called vestibular folds, or sometimes referred to as false vocal cords, which play no role in speech. Rather, close the glottis during swallowing to keep food and liquids out of the airway. The inferior pair, called vocal cords, produces sound when air passes over them during exhalation, while the opening between the cords is called the glottis. So here we came to an end to the upper respiratory tract, where we got an overview of the relation of respiratory and cardiovascular or circulatory system. Then we discussed different parts of the upper respiratory tract, how air enters the nasal cavity, making its way through the pharynx or throat, comprising of three parts: nasopharynx, oropharynx, and the laryngopharynx. Then, entering the last part of the upper respiratory tract, the larynx, also known as voice box, because it is involved in the production of sound. Epiglottis works like a lid to cover the larynx, thus preventing the food from entering the airway. But the journey doesn't end here. Now you must be curious to know what happens next. So, to satisfy your curiosity, you need to watch the next sections. So, stick to the video till the end.